Creel. I'm an occupational therapist at UAMS. I work in the hand rehabilitation department. To describe what an occupational therapist does, we have to understand the definition of occupation. And an occupation is what I do, what you do through your day, meaningful activity that fills your day. Children have occupations. Their occupation is play. She's retired, but she's a grandmother keeping 2 grandkids, okay? He's a plumber. Everybody has their occupation. And understanding that, my goals, of course I want full joint range of motion and strong and you know, the stuff that we can measure in the clinic. But really, what were you doing before you were hurt? What are our goals? And let's establish a timeline and a set of steps that we're going to go to get where we're going. Because everybody wants to be independent. Nobody wants to ask other people to do things for them. And that's not just the workforce, that's the elderly, that's the patients with dementia or Alzheimer's, that's the patient with low vision. We have got to figure out where the patient wants to go. You know, their independence is key. It's forefront in what we're doing. Turning your pages in your songbook at church or signing your name on a check. When those little simple tasks are taken, you become dependent. Plus or minus whether you have pain. It's easy for patients to get down, particularly when this is an ongoing, it's been going on for several weeks. They can't feed their baby, or they can't make the bed up, or they can't drive their truck. And after a while, it's human nature for us to have a tendency to get a little depressed when we get knocked out of our routine. Some people handle injuries and handle conditions very well. These are the people you see that you think nothing's going to bring these guys down. Other people aren't, and it takes a little more pushing sometimes some pulling. I have 2 boys and they're very different, you know, and patients are the same. You can't treat everybody the same way. And so after a while you've been working, you realize you kind of just figure out how to get in some people's heads and figure out what's going to be the best for them.